Welcome. I'm Dr. Sandeep Bhasin from Kerala Medical Center. Today I'll be talking about hair transplantation. This is a cosmetic surgery which is becoming more and more popular and more people are opting for it. Hair transplantation is the treatment which we advise when the hair loss is significant and you're not able to cover it with either medicines or other conservative treatments like mesotherapy, PRP or with the lasers. So in those conditions where the hair loss is too great, then we have to go for hair transplantation. Now there are two methods of hair transplantation. We know FUT and FUE. FUT is the method where we require to take a strip and we require to stitch. So that is also called the stitch method or the strip method of hair transplantation. On the other hand, FUE, follicle unit extraction, is the method where we don't have to take any strip. We take only microfollicular units, grafts, by special machines or punches. So there is no stitch, no scarring in FUE. Presently, FUE is becoming more and more popular as compared to FUT. Why is it so? Well, there are very obvious reasons. In FUE, now we can take up to 4,000 grafts in one sitting, compared to FUT, where we can only take up to 2,000 grafts in one sitting. Number two, in FUE there is no scarring, no stitching, and the post-operative pain is less as compared to FUT, where there is a scar and there is a post-operative pain. Number three, the donor area for FUT is only on the back of the head, but FUE we can take from the beard area, from chest, or from any other area where we got adequate hair from the body. So the donor area is much bigger for FUE as compared to FUT. So these are the reasons why FUE is becoming more and more popular as compared to FUT. Now we are doing this hair transplantation for last 5 years. And when we started, we were into FUT and then slowly we shifted to FUE. In the beginning, when we did FUE, we were doing about 1,000 grafts, and now with our technical expertise, training, new equipments, we are able to do about 4,000 grafts in one sitting, provided the donor area is adequate. And why should you choose the Kerala Medical Center for doing hair transplantation? Well, the reasons are very obvious. Number one, we are into cosmetic surgeries for last 10 years and we are doing hair transplantations very extensively for last 5 years. And we are one of the pioneers to do a FUE hair transplantation. And number two, we are one of the few centers which are able to do 4,000 grafts with FUE in one sitting, which very few centers are able to do. This is called our expertise, training that we have got and our team has got. Number third, in the cases where the people are ready, we can combine PRP with hair transplantation. So when we combine PRP, platelet-rich plasma therapy with hair transplantation, the results are 20% better. So this is what we are doing from last 4 years. We are combining PRP with our hair transplantation. This technique we call bio hair transplantation. That means we use PRP and hair transplantation together. So that is another reason. Number fourth, our team is highly technically trained. We are the best teams in India and abroad. And our doctors and team members keep attending all the conferences, seminars that are happening on hair transplantation and cosmetic surgery, so that they constantly keep upgrading themselves. And most importantly, our price is very economical. If you compare the price in our setup and in any other good standard setup, the price would be substantially less, but the results would be much superior or equal to what we'll get any other good center to compare with. So with these obvious reasons, let's come and have a look how do we do FUE hair transplant in our setup. Once the patient is selected for hair transplantation, we do the shaving of the hair, marking of the donor area and the recipient area. Once the marking is done, we take the patient and give local anesthesia. Now we give very minimal local anesthesia and use minimum amount of xylocaine, which reduces the post-op swelling and side effects. Once the marking is done and anesthesia is given, we fill the fluid in the soft tissue, and this is called tumescent. This fluid decreases the bleeding while we take the grafts and implant the grafts. Once this is done, we start making holes in the recipient area. The holes are made with this very special needle, with a special burr, and the holes are very close to each other, so that we get a good density of hair. We try to make about 40 to 50 holes per square centimeter. Once this is done before graft extraction, it helps us to reduce the time delay between the grafts and implanting the grafts. Now I'll show you how do we extract the graft by FUE. We can see this FUE grafts by this machine that is called FUE extraction machine, and with these the hair with the roots are coming out. So these we remove, these micrografts we remove. Each graft has got about 2 to 3 hair follicles inside it. So one graft has got a bunch of 2 to 3 hair with the roots in it. Once these grafts are there, we store this in a special solution and we store them in cold temperature near 0 degree, from 0 to 4 degrees centigrade. So this we try to implant these grafts within 4 hours after extraction. Once the grafts are there, we start implanting these grafts in the holes. For this we need special instruments, and these instruments are very fine instruments, forceps, which help us to implant these grafts inside the holes which have been made. So you can see this, we are implanting these grafts in these holes, and once this all grafts have been implanted, the whole area where donor area gets filled, the whole recipient area gets filled with the grafts, and once this is done, we finish it with a dressing and we advise the patient a good post-op care. Action. We have just seen how do we do FUE hair transplantation in a patient or client. Now what are the post-operative important things to understand? The first very important thing to understand is that we do the dressing and we remove this dressing on third post-operative day. So that dressing, we have to just take care of that dressing. Another thing is, in some cases we get small edema or the swelling around eyes and face. This is not harmful, this is nothing dangerous. It is inconspicuous, it will go away and it is not going to cause any harm or damage to the patient at any cost. What you have to really understand is this swelling is innocuous and without any adverse effect it will pass away. Now another thing that you have to understand is the results of the hair transplantation would be evident only after 4 to 5 months, not before that. So wait for 4 to 5 months. Don't get impatient. Like in second month, the grafts grow and they start shedding. So many patients and clients get very impatient. Doctor, I am losing my hair. So at that time, just remain calm, maintain your patience. As 4 or 5 months pass, and sometimes it takes 6 months also, you'll start seeing a lot of new hair growing and very wonderful results coming to you. So with this, I just thank all of you for listening, patient listening, and being with us.